Very good evening, friends. Yes. So first question is, which enzyme defect will lead to increased 2,3 DPG or BPG? Yes, leading to low glucose in vitro. This point is important. As you know, in RBC, Rappaport-Lewis shunt, we know 1,3 biphosphoglycerate is converted to 3-phosphoglycerate by phosphoglycerate kinase. If phosphoglycerate kinase is not there, definitely this will be diverted towards synthesis of 2,3-DPG. Yes, one according to few students, option E was pyruvate kinase. Pyruvate kinase. So answer is B. For the time being, answer is B. If option pyruvate kinase is given, yes, if pyruvate kinase is given, they have given the word, two words, in vitro. First thing, yes, and glucose is low. Yes, if pyruvate kinase is not there, glucose should be high. Okay, dear. So if one to choose between pyruvate kinase and phosphoglycerate kinase, I will go with phosphoglycerate kinase. Any other point? Yes. Now, so second question, very repeat question. Every time they ask, steps in PCR in order. Yes, denaturation, two strands are separated. Annealing, primer get annealed to DNA, extension or elongation, polymerization of DNA. Yes. Okay. So denaturation, annealing, and elongation. This is the answer. Answer is A. Answer is A. Hybridization is a yes, we use in bloating technique. Yes. Next question. Yes. Next question. Any doubt? 1-year-old child is suspected to have glucose 6 phosphatase. Glucose 6 phosphatase deficiency. Yes. That is von Glucase disease. Glucose 6 phosphatase is deficient. Kidney enlarged, increase lactic acid, uric acid, triglyceride increased, and there is fasting hypoglycemia. Yes, fasting hypoglycemia. You know, whenever liver glycogen storage disease, main feature is fasting as hypoglycemia. So answer is fasting hypoglycemia. Yes, answer is D. Next question. Which of the following is true about Gaucher? Yes, this was frequently asked question. I told you that Gaucher, gouch, ouch, bone pain, and you will give tissue paper. Yes, and she will crumble tissue paper appearance. Beta glucosidase deficiency or glucocerebrosidase. Yes, deficiency. Okay, in this. You know, Niemann-Pick disease, sphingomyelin is deficient, and there is hepatosplenomegaly, foamy appearance is there. Neem soap, mnemonic बनाया था हमने, we made mnemonic. So sphingomyelin is defect in Niemann-Pick disease, foam cell in Niemann-Pick disease. Answer is A and C correct. So answer is B. Answer is B. Next question. Which of the following are true about HMP shunt? Yes, HMP shunt, no ATP produced. We have already discussed multiple times. HMP shunt, no ATP produced. The rate limiting enzyme is G6PD. Yes, and produce pentose sugar. That's why it is also called pentose phosphate pathway. And it produce NADPH, NADPH, not NADH, not O2. So this is true. This is true. Non-oxidative phase is reversible. Yes, this is repeat question. मिशन क्लास में भी हमने डिस्कस किया है डिटेल में. हर बार मैं पॉइंट आउट करता हूं, दिस इज इरिवर्सिबल oxidative phase, reversible non-oxidative phase. So this is also true. So answer is A, 1, 3, and 4. Yes, true about HMP shunt. Yes. Next question. An experiment targeting epigenetic modification, rheumatoid arthritis patient, Sanofi, increase expression. This is important. Increase expression. You know, acetylation of histone. What do? Acetyl group is having negative charge, histone is having positive charge. If you bind, charge is lost, DNA will relax, euchromatin formation, increase transcription. So acetylation of histone, increase transcription. Yes. And deacetylation of histone, again, condensation, decreased transcription. While methylation, DNA methylation, we know that methylation of cytosine at promoter region decreased transcription. So if you inhibit DNA methylation, there would be increased expression. Answer is B. Answer is B. Actually, C and D both are same thing. They have given. Next, deficiency of which cofactor shunts 3-hydroxyquinoline into xanthonic acid pathway? You know, normally 60 milligram of tryptophan give rise to 1 milligram of niacin. Yes, baby doll, indole ring, tryptophan, we know. Yes, this is converted to 3-hydroxyquinoline, then 3-hydroxyanthranilate, multiple step niacin. And cofactor is vitamin B6. If vitamin B6 is deficient, then this step would not occur. Yes. Yes, so this will be diverted towards xanthonic acid. This will be diverted towards xanthonic acid urea. Actually, this question has been asked previously in our exam. I told you. Yes, this is matching. Answer is pyridoxine. Answer is pyridoxine, vitamin B6, active form pyridoxal phosphate. Next question. Match the following. Repeat question. Tyrosine, thyroid hormone, precursor for thyroid hormone, tryptophan, one fate is 60 milligram of tryptophan give rise to 1 milligram of niacin. Tryptophan is coming to serotonin, then coming to melatonin. Glycine is used in creatine, create, mnemonic was, game create karo, bajana nahi hai, create karna hai, glycine, arginine, and methionine. Creatine, glycine is there, cysteine from taurine. So simply, if you know initial, you can find the answer A1, A1, B2, B2, C4, D3. Answer is B. Answer is B. Okay. Next, which of the, yes, this was repeat question, just to tell you that in our class we have discussed this question. Okay, so if you have little bit about idea about xanthonic acid urea, so you can easily find that this 3-hydroxyquinoline is a intermediate of tryptophan metabolism, and there was interruption of this metabolic pathway lead to xanthonic acid urea and cofactor vitamin B6. Yes, these are previous year questions, just to tell you. In TCA cycle, which intermediate serves as the main substrate for fatty acid synthesis? Actually, this is in tricky question. You know, in fatty acid synthesis, we start from acetyl coenzyme. And we found that this acetyl coenzyme are transferred from mitochondria to cytosol with the help of intermediate of TCA cycle, citrate. So, you know, acetyl coenzyme bind with oxaloacetate, to form citrate. This citrate come out of the mitochondria. Now citrate is again converted to acetyl coenzyme and oxaloacetate. This acetyl coenzyme take part in fatty acid synthesis. Okay, good. So answer is A, citrate. Clear? Next question. Yes, this is a recall based question. What was the exact question? We don't know, but as I could collect, true about fatty acid synthesis. In fatty acid synthesis, the first and rate limiting enzyme catalyzed by acetyl coenzyme carboxylase, yes, cofactor biotin. And mnemonic was carboxylase. Wherever carboxylation is there, mnemonic is ABC. Car में एक्सीलेटर होता है, ब्रेक होता है, क्लच होता है. A for ATP is used, biotin is used, CO2 is joined. CO2 is joined. So ATP is used in this process. This is true statement. While other statements are they are talking about beta oxidation of fatty acid, not fatty acid synthesis. So you can easily find out the answer this. But to complete the concept, we have to point out in beta oxidation of fatty acid what happens. First of all, fatty acid is activated. Activation of fatty acid, yes, this require 2 ATP. And now fatty acid enter intermembranous space, acyl coenzyme A bind with carnitine to form acyl carnitine plus coenzyme A. This is done by CPT1, which is present at outer mitochondrial membrane. Yes, CPT1 is present at outer mitochondrial membrane. Outer mitochondrial membrane, not inner mitochondrial membrane. This is false statement. Coenzyme A. Yes, when this reaction occurs, coenzyme A is produced in intermembranous space. Yes, so you can say release in cytosol, not it is released in intermembranous space. Carnitine is released in mitochondrial site. Yes, this acyl carnitine is transferred. Then acyl carnitine is going to acyl coenzyme and carnitine. Yes, this is released here. Okay. Okay, so this is true. Okay. Statement is true. Carnitine is released in mitochondrial site. So according to question, you can find the answer. What was the question? So this is beta oxidation of fatty acid. Patient undergo folate therapy. As you know, vitamin B12 and B9 both work together to convert homocysteine to methionine, and if B12 is deficient or B9 is deficient, both lead to non-classical homocystinuria. Yes, B9 and B12. We found that in this reaction, yes, methyl B12 is converted to B12. This B12 is converted back to methyl B12 with the help of methyl tetrahydrofolate. If B12 is deficient, then methyl tetrahydrofolate will not be reutilized. This is called folate trap and functional deficiency of folic acid. So this is the reason many times when patient of megaloblastic anemia is there and we give folic acid and don't give supplement of B12. Yes, B12 deficiency will persist. Megaloblastic anemia may respond, and this will lead to subacute combined degeneration of spinal cord, and these symptoms will worsen neurological symptom. So what is the reason? Yes, folate trap. So these are the recall based question. Whatever modification you have, please any other question or point you can suggest me. We will include in the main videos in detailed discussion we will have on app. Okay, thank you. Good night.